Today we're covering some of the most dreaded H words that affect your health. Joining us now is Amy, who's here to share our next issue. So Amy, what is your complaint?
Well, I play roller derby, and because of that, my legs tend to be a little overdeveloped, so I have huge calves. It's really frustrating because I can't fit into any fashionable boots or anything like that.
So you're a full-on roller derby athlete, part of the Bellingham Roller Betties in Bellingham, Washington, is that right?
Yes.
So how often are you working out your calves?
Well, I practice with my team about 10 hours a week, and then I also cross-train on top of that.
Wow. So a lot of this, sometimes calves can just be determined by your DNA, but obviously when you're working out that much, you're building a lot of muscles in your calf.
Yeah.
I mean, calf muscles, the more you work them out, the more they're going to enlarge.
Yeah.
So part DNA, part working them out. So what to do? Well, you know, some people say elongating the muscle, yoga, stretching may help with elongating the muscle so it's not quite as quote-unquote bulky, but that's not always going to provide the answer.
I don't think that's realistic in Amy's case because, I mean, she's using her legs so much for her roller derby, which we don't want you to quit. So I don't think that that's really a viable solution.
So what to do then?
Well, I have a couple suggestions. Have you heard of these boot bands?
I have not.
Amy, so let's say you have this boot here. This company puts these out called boot bands, and you zip them in to your zipper. And I've seen pictures of these. They actually look very, very cool and fashionable. So this way you're immediately expanding your boot, and they come in different sizes depending how much you want to expand that. So that's an option. Now, I do have patients that come to me complaining of large calves and ankles, and for certain patients, liposuction is another way to treat that. So let me take a look at you. What I want to do is determine how much of your calf is muscle and how much of it is fat.
Okay.
If you have a little bit of extra fat there, we can treat that with liposuction, and that would make your calves smaller, okay?
Okay.
So what I want you to do is stand up for me. I'm gonna turn you slightly this way, and I want you to stand up on your toes, okay? Obviously, well-developed muscles, but I can pinch here and determine how much fat you have at the same time. Okay, relax. And you do have, you know, a fair amount of subcutaneous fat. You can have a seat again in your calves. So you would be a candidate for permanently removing that fat with liposuction. We put patients in a prone position on their tummy, tiny incisions, usually in the knee area, and we inject fluid in there to distend it, a so-called tumescent liposuction technique. And with standard liposuction techniques, we can permanently remove the fat in that area, and it works pretty well. So that would be a possible option.
So obviously these are options, but first I say we go conservative route. How about if we give you a pair of these boots to rock? What do you think?
Yes.
Would you be willing to give it a whirl?
Look at that. Look how cool that's going to look.